Victoria, thank you for being patient, and we apologize for our technical difficulties. Before I get started, I want to introduce myself. I'm Ashley STREVEL, the Director of Communications and Public Affairs for the City of Victoria, and we have some special guests here today, including our public health officials and hospital administrators. So I will introduce them here to you right now. From left, we have Christina Adrean, CEO of PAM Specialty Hospitals of Victoria. David Gonzales, Victoria County Public Health Director. Dr. John McNeill, Victoria's Public Health Authority. Mike Olson, CEO of Citizens Medical Center. And Bernard Lagarde, CEO of DeTar Healthcare System. We thank them all for being here today. So the purpose of today's press conference is to provide you all a public health update about COVID-19 in our community and its impacts in our local hospital system. So we're going to focus on that effort today. But before I do want to address a few questions we've been getting about whether or not the city or the county will be issuing any local orders. That is not the case. In fact, we are under Governor Abbott's orders, which indicate that the authority to enact COVID-19 related restrictions, such as mask mandates, business occupancy limits, and restrictions on mass gatherings, lies with the state, not with the city or the county. For more information about state regulations, you can visit gov.texas.gov. With that, I will now turn it over to our guests, and speaking first will be David Gonzales. Thank you.
Thank you, Ashley. Due to the highly infectious Delta variant, we are now experiencing a resurgence of COVID-19. Over the past 7 days, we are now seeing more than 60 new cases per day, which is about a 10-fold increase from what we're seeing in June of this year. According to the Centers for Disease Control COVID data tracker, Victoria, like much of the country, is now considered an area of high transmission, which is why we are now recommending increased prevention measures, especially masking in indoor settings, regardless of vaccination status. If we look back at our last two spikes of cases over the holiday season and last summer, it's difficult to compare those situations to the current situation, mainly because two major differences. For one, we now have a great offensive weapon with vaccines to help us limit the spread of the virus and greatly reduce the number of severe cases. Secondly, though, we are now dealing with a more infectious and aggressive variant of the virus. So what can you do to protect yourself? First of all, as I mentioned before, wear a mask indoors. Also, it is now more important than ever to isolate and quarantine according to public health recommendations to limit the spread of the virus. But most importantly, get vaccinated. In Victoria County alone, when we started tracking data about 2 months ago, we're seeing that over 80% of new cases are among those who are unvaccinated. More specifically, and perhaps the most telling piece of the effectiveness of the vaccine, is that we're seeing over a 98% effectiveness rate against severe illness and hospitalization over that same time period in new cases. Overall, the vaccine not only prevents you from being infected, it also prevents you from spreading the virus to others, and as I mentioned before, it greatly reduces your chances of severe illness and hospitalization. Not only has the vaccine been proven effective, but has also been proven to be safe. One clear indicator of the safety of the vaccine is that recently Pfizer has achieved FDA approval, and we anticipate that the Moderna vaccine is not far behind. In conclusion, we need your help. We need our citizens to all do their part in limiting the spread of COVID-19 by taking those actions and preventative measures I just mentioned to keep our community healthy and safe. I'll now turn it over to Dr. McNeill.
Thank you, David, and thank you for letting me speak today. You know, we've been coming up here a long time, and this is our first press conference in a while. And the thing that you'll notice is different is that we have the hospitals represented here today. That's not by accident. They're represented here today because that's what we need to talk about, and that's where the problem is right now. You know, years ago, if it seems like years ago, months ago, we had talked about community spread, and we talked about different transmission, and we talked about all the modalities, and I remember talking about how nice it would be to get a vaccine. Well, we have a vaccine, and now I'm going to talk about how nice it'd be if every one of you'd get it. So, but let's talk about the hospitals. And that's the main reason these people are here. And we're fortunate to have these experts and these professionals This is a tip of the spear for both of all three hospitals here. So if you need information, they're here today. And we really appreciate that. Okay, the first thing I want to explain the situations that's going on in our hospitals. Since the very beginning, we've said that pretty much hospitalization is kind of where the rubber hits the road. The worst thing that could happen in our society is if we get to a point to where our hospitals become overwhelmed and they're unable to take care of the sick. This would be because of COVID, but this would also and people that break their arms or children that get hurt or whatever, God forbid. But there are things like this that happen, and these things continue to happen, but they still take resources. And when you have as much of your resources being used as what we're using right now on COVID, then that becomes a problem. Now, a couple of weeks ago, I can tell you that it was a lot worse. And had I been up here 2 weeks ago, the story would have been a lot worse. But some things have changed, and our hospitals are a little bit better equipped right now to take care of this pandemic. But that reason is simple. We got extra help from the state. Both the hospitals, and they can tell you about it in a minute, but they'll tell you that we got a bunch of extra nurses, agency nurses, that came down and allowed us to open more beds, allowed us to staff our ICUs, and very importantly, allowed us to actually give our workers a break. I can't overstate the amount of stress that our employees and our people and our caregivers in this area have been under. They are truly the unsung heroes. They're the people that get up every day and literally risk their lives to come take care of people they don't know. And they do it every day. And a lot of them are sick, and a lot of them have gotten sick. And unfortunately, there are some that have lost their life to it. So we are fortunate, and we're in a little bit better shape than we were even just a few days ago, because we do have these extra nurses. So extra nurses, extra techs, and just a few nurses means the difference being able to open up more beds, and that's what we've been able to do. This still continues to be a challenge because of these resources, but at least we're able to do it. You know, right now our hospitals basically are carrying 60 to 80 people between each one of them, and you know, these are 60 or 80 beds that are filled. And you know, I tell people all the time that this is the slow time of year for hospitals. We should be able to let some people take vacations. We should be able to regroup and rethink things we're going to do, because we know that in the next few months we're going to be a lot busier. But that's not the case. We're as busy as we need to be right now. Now, let me just say this, and so that everybody will know. One of the most important things that I want you to take home from what we're talking about today is that our hospitals are stressed, and our hospitals are working hard to keep up, but our hospitals are able to take care of you, okay? Do not ever think that you're not going to go to the hospital and you stay home and get sick and get worse, okay? We can still take care of you, and we will continue to take care of you. We're not at that point. We're just at the point to where we need help. And that help is that we need to decrease the number of people coming into our hospitals if possible. So I know the hospital administrators probably didn't want to hear decreasing number of admissions, but for the most part, that's where we're at right now. So how do we do that? Well, we do that by the only things that we have the only resources that we have. The only things we have available right now are great things, and the greatest is a vaccination, okay? You have got to get vaccinated if you can, and very, very, very few people have a reason that keeps them from being successfully vaccinated, okay? You have to understand something. When people die from COVID, and when people get seriously ill from COVID, they're usually not at home, because it doesn't happen quickly. This is a disease that lingers, and this is a disease that lasts, and the recovery is what we call nonlinear. In other words, people don't get well at a certain pace. They get a little bit better, then they fall back, and they get a little bit better, then they get worse. And sometimes they don't recover. But the important thing to remember is that this happens in the hospital, okay? This happens in the hospital, and this takes a lot of resources. So one patient can be there for months, and it's not uncommon to see that. We see them there for weeks all the time. So the thing to remember about the vaccine, statistically and nationwide, you are 29 times more likely to end up in the hospital if you're not vaccinated. 29 times more likely, simply because you didn't get vaccinated. Think of the vaccine as your I'm not going to be in the hospital shot. Okay, so you get your vaccine, so you get a little bit of a low-grade fever. You feel bad for a day or two. That's better than COVID, folks. I'm here to tell you. So think about that. You're also 5 times more likely to contract the illness if you're unvaccinated. It's not uncommon for over 98% of all the people that are sitting in our hospitals right now, and I can tell you that about 98% of all the people that are in our hospitals all have one thing in common. They're not vaccinated. That would be a lot more rooms, that would be a lot more stress on our system that would be available if people were vaccinated, okay? So that's the deal on vaccines. I think we all know that. Now, vaccines are really available. They're easy to get to. You can go anywhere right now and get them. All the pharmacies, most of the pharmacies have them. You can call the health department. You can go to vaccine.gov. There's a lot of ways to get the vaccine. So please reconsider it for yourself and for your family and try and get yourself vaccinated. The other thing I'm going to talk about is the recent uptick in cases. So we have seen a lot more cases because of the Delta variant. And we've all heard about the Delta variant. We all know that it's more contagious, and we know that it's more dangerous. And it's more dangerous because more people are getting it. The viral loads, in other words, the number of viral particles found in our nasopharynx with this variant as compared to the last UK variant is about 1,000 times higher. This vaccine has mutated, and they don't typically mutate to get friendlier to humans. Vaccines are obligate intracellular parasites, and they're going to turn whatever they get into a virus factory. That's their job. That's all they know how to do, and they're very good at it. So you've got to remember that when we are vaccinated, we take away this reservoir. We take away this ability for this virus to continue to replicate and, more importantly, continue to mutate. So it's another reason to get vaccinated. I want to talk to you a little bit about the school cases. We're seeing a lot more school cases. I won't bore you with numbers, but I can tell you that a lot more younger people are getting sick, and that's part of the Delta variant as well. We're seeing numbers in schools that we've never seen before, 10 times what they were at least. So we're seeing a lot more, and a lot of that has to do too with the fact that a lot of children, a lot of school-age kids are not wearing masks. Now, I'm not up here saying we're going to make a mask mandate, because it's very clear that that's not going to happen. But I am going to stand up here and say, tell your children to wear a mask, okay? Tell your children to wear a mask, and we can slow the spread of this disease. We don't have a whole lot of other options. We've got the vaccine, we've got social distancing, we've got masks, we've got some things. But you know what? Before we had the vaccine, we did pretty good with social distancing and masking and avoiding crowds. We did those things, and we did pretty good. But we're not doing those things very much now. So we need to get back to those things, because we've got to slow the spread, not only for our own health, but for the health of the people that we care about, and the health of the community, and the health of the hospitals. So those are things that are important. Let's see. I've talked about the Delta variant. I've talked about that stuff. Really and truly, folks, you got to understand that as far as getting vaccinated goes, remember, and this is another number, if you don't remember anything else about this, remember this number, that 15 out of every 16 people in the United States that die from COVID, 15 out of every 16 have one thing in common. They're unvaccinated. So get yourself vaccinated, wear a mask. We're asking everybody, just like the CDC states. The CDC has not changed their mind on this once they decided that masks were good. So we're going to continue to wear masks. We hope you will. And please get vaccinated, stay safe, stay away from sick people. Okay. Any questions for me? Should I take questions now? I'll take questions if y'all have any. Yes, sir.
So we've been getting a lot of questions from parents who are concerned about the increased number of cases in kids that you were mentioning. How many of those kids are requiring hospitalization, or how many of those infections are severe?
Okay, the question was, as far as children getting infected, how many of those are actually turning into severe infections? Nationwide, the number of children being hospitalized has dramatically increased. And this is attributed to the Delta variant. It's also attributed to the fact that this Delta variant is more contagious, and it's now in schools. Interestingly, we seem to have been spared pretty much the schools in the last go-round with this stuff. We didn't have as many children, school-age children, that were getting it, and that kind of surprised us, to be honest with you. But that's not the case with Delta. Delta is more contagious, and we don't really know if it's more contagious because to younger people, or if it's just because the virus is going to find a reservoir, and most elderly people have either had it, or they've gotten real sick and didn't survive, or they got vaccinated. So that reservoir is not as available anymore to the virus, so I think it's moved on to younger children. Now, as far as the numbers, I don't have specific numbers. I know that there are several hundred across the United States every day that are hospitalized, but I did speak to the pediatricians last night, and they told me that they are seeing COVID left and right in children. I've seen 1-month-olds. I've seen a couple of 2 or 3 week old babies with COVID. I've seen children of all ages now that are coming up COVID positive. And that was a rarity before, but it's not rare anymore. And it's being spread a lot in the schools. So we can help mitigate that. We're encouraging all school children and parents encourage your children to wear masks at school. Okay.
And we've just got a follow-up question on that from a reader, but would you say if there's more kids wearing masks in schools, that could cut down on the rate of spread, cut down on the rate of infection locally?
The question is, if all children were to wear masks, would that cut down infection? Let me tell you, I don't have a big study that says X number of children are gonna do better if we wear masks, but I will tell you this. Common sense tells me that it would work. And the second thing is, if you want a real-life example, look at the flu last year. I saw cases, we saw countless cases of flu every year until last year. You know what I saw last year? 0. And a lot of doctors I know didn't see any either. We didn't see it because we social distanced, we washed our hands, and we wore masks, okay? I think that we can beat this. The CDC thinks we can beat this with masks and doing those other procedures, and I think we should do it. Okay, all right, great. Thank you very much.
Do you have any other questions before we move on?
I've got another couple.
Absolutely.
I'll try and keep it pretty quick, but another question from a reader, and this is one we've been getting pretty often, but how do you guys know that these are Delta cases we're seeing? Are you testing for the variant, or how can we know that it's Delta that's contributing to this spread?
It's a good question. I'll let David take that one.
So yeah, it's definitely a question we get quite often. And 2 pieces of that. One, the identification of Delta variants and specific variants of cases are done on a statewide, nationwide level. So the Department of State Health Services will essentially survey labs across the state, and specifically genotype certain samples that are gathered at those labs. And with those, they determine the variant at those levels. As far as locally, our labs don't specifically create or extract those samples, genotype those samples to figure out which ones are Delta variant. We go with the state average. Basically, we assume the average is similar to the state and nationwide average, which last I checked is somewhere northwards of 96% of the cases, and maybe even a little higher now, of all cases are Delta variant. So we don't know specifically each case if it's a Delta variant or not. The thing is, the way you protect yourself from it's all the same regardless of variant. So it doesn't really change our strategy at all.
We've also been getting a lot of questions about breakthrough cases, questions about does that mean the vaccine's not effective, or what explains why some people get vaccinated and still get sick? So are these breakthrough cases, is that a reason for folks not to get the vaccine? Does that mean the vaccine isn't as effective?
Dr. McNeill can answer that one.
Thanks.
That's a good question, and he's asking about breakthrough cases, and these by definition are cases where a person's vaccinated but they still come up with the disease. The thing to remember about that, and one thing I haven't liked about this is that the people that don't believe in vaccines say, well, that guy got vaccinated, he got it, and he ended up with COVID. Well, I tell you what, he didn't end up in the hospital and he didn't die, okay? So that's the end point. So yes, there are breakthrough cases and it does happen. The initial effectiveness of the of the Moderna and Pfizer vaccines were anywhere from 91 to 96%, depending on the literature you read. Now they say it's about 61 to 70%, but that's been over the last 6 to 8 months. Booster shots are coming, and that won't be long, and they do recommend them. The CDC has recommended it, and all 3 of the major ones, Moderna, Pfizer, and J&J, will have booster shots available in mid-September. There's word that you're supposed to wait 8 months, but we were told from an article yesterday that it may change it to 6 months. So booster shots are on the very near horizon. They are very much recommended, and I'm getting mine. Okay.
I just wanted to, as a reminder, we do have our local hospital administrators here, so if you have any questions for them, they will stick around, be here to answer those and provide closing remarks. But we'll take a few more questions, and then we'll allow them to go ahead and make some remarks.
Sure, appreciate that. I was also going to ask about staffing. I know a lot of hospitals have been spread thin in this regard. How much support have you gotten from the state when it comes to staffing, and are you in good shape now?
Sure. Mike Olson, CEO of Citizens, will go ahead and start that.
Good afternoon. Definitely staffing has been the biggest challenge that I think all hospitals are experiencing right now. We had a shortage before all this happened, and then when the next surge took place, it just made it worse for us. So we have available beds, but we did not have the staffing that we needed to be able to open up those beds safely for the patients that we had, given the ratios of nurse to patient ratios and that sort of thing. But the state stepped up, and we really want to congratulate and thank them for doing that, because the first time we experienced this, that was what saved us and got us through. So just recently, we received 13 med-surg nurses at Citizens, I think it was just yesterday. And I think in total we have 26 now staff that the state has provided, and that's significant. That's allowed us to open up 4 more ICU beds and probably an additional 18 med-surg beds that we didn't have before. That has been extremely helpful for us in handling the current surge that we're in.
Are you guys in good shape in terms of equipment, PPE, other resources like that?
Well, speaking on behalf of Citizens, yes, we are. We've got plenty of PPE, the gloves, the masks, the gowns, and all those things are there. Our ventilators, we have adequate ventilators, and all the other things that we would need to take care of patients. So it's staff that has been the biggest challenge for us. And we're very grateful that we have them. They've been a big help. They've come from all over the various states, and we've welcomed them and just made them part of our team. It's been very good to have them here. Big help.
And we're very appreciative of the state staff we received. We received respiratory therapists, we received nurses. This helped us open up additional COVID beds. As Dr. McNeill stated, the Delta variant is highly contagious, so we have to make sure our staffing is separate. So the COVID unit, we cohort the COVID patients, and then the state staff, we're able to dedicate them just for the COVID patients. For PPE and equipment, STRAC has been extremely helpful if we're running out of airvos or just different equipment that the COVID patients need. We were able to obtain them as well.
Hi, good afternoon, everyone. So similar to Citizens and post-acute, we actually received a little over 30 nurses last week and this week. So as they said, it allowed us to really add to our capacity, open up some additional beds. Similar to them, we're very good on PPE as well, which is critical for us to safely take care of our patients, and our equipment at this time is very good as well. So.
All right. Well, with that, we will go ahead and wrap up today's briefing. I do want to real quick make sure that you know who is in the room, and these are our hospital administrators here in Victoria. So one more time, I am going to ask them in a second to come back up and provide any closing remarks that they wanted to share with the community while you are watching. And so real quick, we do have Christina Adrean, and she is our CEO of Post-Acute Medical Hospitals here in Victoria.
Thank you, Ashley. So it seems like every time you look at the television or look at social media, there's always something about COVID. But what we really want you to take home today is that what we're presenting to you all is what's happening right here in our community. PAM Health, we have long-term acute care hospitals and rehab hospitals. And the long-term acute care hospitals, we take care of the sickest of the sick patients. What we're seeing this year is very different from last year. This year, we're seeing patients as young as in their 30s, 40s, and 50s, and they're coming in needing medical equipment because they can't breathe. They literally feel like they're suffocating. And it's scary because these are young people who have young children at home. They have spouses that they need to take care of, but yet they're in the hospital for weeks. It's not just a few days, they're there for weeks and weeks. We do have patients who do recover and they receive rehab, and what I want everyone to know is that COVID has long-term effects. You know, there's a lot of fear out there about the vaccine. Are there long-term effects or future effects with the vaccine? There's been no proof or data supporting that, but there is proof that COVID does have long-term effects. We see patients who did recover in our hospitals coming to outpatient who still require speech, physical therapy, occupational therapy. They have brain fog, they still feel weak. and it goes on for weeks and weeks. What we ask for y'all to do is, everyone is entitled to their opinion, to their beliefs, and what we want you to do is to make an informed decision. Speak to your doctor if you have concerns about the vaccine. Speak to your clergy if you have religious concerns. We want you to make an informed decision and have the best information that you have, and protect yourself, protect your loved ones, protect each other. I personally am vaccinated, and I personally made a choice to vaccinate my children. I have a 12-year-old, a 14-year-old, and a 16-year-old that attend VISD. And I did choose to get them vaccinated. I did speak to their physician, their pediatrician about it. I spoke to different doctors that I work with, and so I made an informed decision for my kids. We can do this. We ask that everyone please do your research by speaking to a professional. Please don't listen to what the media is saying as far as what you're seeing on online. Talk to your doctor and talk to your clergy and make that decision. Thank you.
Thank you, Christina. And next, finally, we will hear from Bernard Leager. He is the CEO of DeTar Medical System.
Hi, good afternoon again. I would like to, Christine did a great job first of really putting that plea out there. I'll take a little different perspective because I think she hit a lot of the high points, right? So I'm going to try and tell you, as the leader of an organization that sees COVID patients every day, number one, how different this variant is from the others. And number two, the difference in age categories that are being affected. For my staff, it is very heartbreaking to watch people in their 30s and 40s expire from COVID. It's never easy, right? And so last time on the surge, our average age was probably in the 60s. It impacted mostly older people at risk health-wise for people. This time around, it's very different. And so I encourage you to please get vaccinated. I am vaccinated. I wasn't first in line at the hospital because I wanted to make sure that caregivers had that opportunity, but as soon as I could, I got vaccinated. And as soon as the booster is available, I'll get vaccinated again with that booster because I believe in it. So again, just from my perspective and what my team see day in and day out, please consider getting vaccinated. So thank you.
Thank you, Bernard. And who better to hear that from than the hospital administrators themselves? And so last, we will hear from Mike Olson, who's the CEO of Citizens.
Well, thank you, and it's an honor for us to be here, and I stand side by side with my colleagues. And first of all, I want to thank all of the healthcare workers out there at my facility and at their facilities. They do incredible work every single day and do the very best they can to take care of patients who are very, very sick. And it's a hard thing to do. It's even harder this time around because the people that they're taking care of, they are thinking to themselves, if they would have been vaccinated, they probably wouldn't be here. And so the first time, nobody knew what was going to happen. Everybody was exposed, and it was the luck of the draw. Now, we're making a conscious choice not to get vaccinated, and I believe everybody has the agency and liberty to make that decision. But what you don't get to choose is the consequences that follow. So if you choose not to do that, you have to be willing to accept the responsibility for what happens afterwards. And it's like they've said, it's tragic to see somebody who's made that decision to not get it or just been lax about it, and then they end up in the hospital very sick. And the first thing they say, I wish I would have gotten the shot. I just wish I'd have done it. Because they'd rather have just had that shot and not be there than go through what they're going through. And just last Sunday, this becomes very personal, and I think many of you probably have family and friends and relatives and people you know, but just last Sunday had a person that I know very close who goes to the congregation at my church, and in his early 50s, and in the hospital in the ICU for a long time, and ended up passing away. And it hit home to see the family suffering and going through all of that, and to think that, man, that he'd still be here today probably if he'd have gotten the vaccine. And I know that that's a hard message, but I think it's a message we all need to try and learn from. And really strongly encourage you to get vaccinated. I'm vaccinated, all my family's vaccinated, and we'll get the booster when it's available. I think it's that important, and I think I've been really encouraged our hospital staff to get vaccinated as well. It's one of the messages I continue to invite them to do. I realize everybody has a personal choice, and I'm a believer in that. I just want you to make an informed decision and look at it based on the facts. The most compelling fact, I think, that we have right now is that in our community, 95% of the people who are in the hospital are unvaccinated. That's a compelling argument for why you should get vaccinated. Yes, you might be one of the lucky ones that doesn't get vaccinated, you get sick and you get over it and you're just fine, but you never know. So why take that risk? Please get vaccinated and help get your family vaccinated so that we can decrease the pressure that's on the hospitals with what we're trying to do to take care of everybody. There's lots of other procedures, lots of other things that need to be taken care of, and our ERs end up getting really full of a lot of people that we're holding over because we don't have beds, and we're trying to get them places sometimes, and it's been a real challenge. And other things come through, and there's other people that need to be taken care of as well. So we need to think about that in the context of what we're trying to do. So just really want to encourage you, get vaccinated if you haven't, and wear masks whenever you can, and indoors and that sort of settings, and try to reduce the amount of spread that we can, and decrease the pressure that we have on the hospitals, and so we can take care of everybody in our community. So thank you.
Thank you, Mike. And thank you all for being here. Thank you all for viewing. Thank you for being present as well. It's clear that hospitals are at a breaking point. This is bad for COVID patients and the community, and so we do have to do our duty to make an informed decision to protect not only ourselves and our loved ones, but the community around us. I just want to thank everyone who's here today again. Thank you for your words and your sobering stories. I know that hits home for a lot of us. So that ends today's press briefing, but one last announcement I do want to make is to continue to stay updated about the facts here in Victoria, which have continued to be provided to the public through our Victoria County Public Health Department. And you can find them on the Facebook page or at vctx.org. And last, just as a reminder, we are in the midst of hurricane season, so make sure that you have a plan, stay prepared, be safe, and visit vctx.org/hurricane. Today's press briefing will be played today at 5 p.m. on our local cable channels 15 and 115 every day through Sunday at 5 p.m. We hope that you were able to tune in. If not, you can tell your relatives and friends to visit that channel. Until then, thank you so much and have a great rest of your day.